and good evening to this 30th post-COVID online session of ICC Crack the Wellness Code. Warm welcome to all of you. As you know that we have been doing these online sessions ever since we were hit by COVID-19, and this is the 30th online such sessions. And this is today's session is on food allergy, nutrition, and eating habits, and we are extremely gratified to have Dr. Sanjeev Jain with us, who has a very distinctive background, and we'll talk about it when he comes and speaks to us. And then we have Veena Uttarwar, who is a holistic nutrition counselor, and she's also coordinating the food project for ICC CWC. And we have Doug Emis, who's a health hero in his own right. So you hear some very interesting story, how people like him is actually, weathering the current situation. And he's always been a food for health evangelist. So it'll be really, really interesting to hear from him. And then, of course, later today, we'll be joining, Erika Deshmukh will be joining us, and she will be talking more about eating habits and how we can improve them, and some of the examples that she's going to cite with all of you. This is going to be an interactive session, and you can start putting questions as we start, the program starts rolling. So this is the panelists you can see. So we are looking forward to hear from them, and of course, managing food allergies come immune systems, holistic nutrition tips, and eating habits, as well as conscious eating is basically what we would try to put together all the content as a takeaway from this webinar. A little bit about CWC. This is our mission: educate, inspire, empower, and impact. And this is the way we do it. So you can see it on your screen. So we started off with conferences, workshop. Of course, we do a lot of online programs. 30th session in the last couple of months. So we have been trying to improve outreach, work with people in the US and globally. The outreach has expanded over a period of time. We work with doctors, more than 30 doctors, associated with this wellness movement. And of course, a lot of programs to empower and impact. A quick look at the journey of ICC Crack the Wellness Code. We started July 2018, and we are now nearing 2 years. And in first 18 months, we did 14 plus events, and then you can see that we have accelerated our efforts. After first quarter. And 40 plus online sessions with 5.5 thousand people, aiming to be reached, not only through these webinars, meetings, but also through on-demand videos. That's something that's coming up. You can see our webinar page also for that. So without much ado, I would like to invite Dr. Sanjeev Jain. The interesting part about him, among other things, there are many things about him, but he's not only a medical doctor, an MD, but he's also a PhD in biochemistry. So as a food allergy, as an allergy expert, and as an immunosystem expert, I mean, he obviously has a very, very different way of looking at viruses and all the microorganisms that trouble us, right? So we're going to really get a grand perspective from Dr. Sanjeev Jain. So once again, thank you, Sanjeev. Good to have you with us. Okay. So one thing that we would really like to ask you to start this whole session today is, a little bit of perspective setting, both as a doctor and as a PhD in biochemistry, how you look at the current COVID situation, the immunity challenges that people have, and basically a little bit of your journey. And we also know that you have some awesome use cases where you have cured patients, which has become a national headlines. So a little bit of that, and then we'll also hear more about, the current challenges, and then we'll very quickly catch up with you with the questions that our participants will be posing in the chat box, and I'm requesting them to do that right away. And you're all here for a treat from Dr. Sanjeev Jain. Over to you.
Thank you very much. It's a real pleasure to have this webinar session. We are, of course, in a totally new environment today. This was just unimaginable a few months ago that we will be all gathering through Zoom and these types of sessions instead of in person. But this is our new reality, and we have had a we have had no choice but to go in this direction. And so I'm very pleased that Crack the Wellness Code team has really transformed the platform into an online platform like this. So a little bit about me. I started my journey as a college student, and like many college students, the dream is a simple one, do something big, find a cure for cancer or something like that. And so at that time, I said the right way to do that is to not only understand medicine, but also understand basic science at a much deeper level that a PhD training can allow. And one pathway I thought would be a reasonable pathway to follow is to understand structural biochemistry so that one can utilize that structural information about biomolecules to come up with the right type of molecules to inhibit different cellular processes to treat cancer, treat different diseases. And when I started my career, actually at that time, HIV was a big pandemic that had just started, and so a lot of structural biochemists at that time really focused on coming up with a new treatment option for HIV. And ultimately, it's the effort of those structural biochemists who were able to design new molecules to treat HIV as a disease. So even though the virus still is with us, but it is a much more manageable disease than it was a few decades ago. So that's really the pathway that I had chosen. But what I realized is that lab research is wonderful, but it's not the same thing as actually treating patients in person. And so that's the reason I made that transition from a biochemist to a clinical medicine doctor. And so I have been treating allergies for over 20 years now. And back in 2007, we had this one kid who came along who had 6 ER visits because of accidental exposure to nuts. And that caused anaphylactic or really severe allergic reactions, which put him in the emergency room with a life-threatening reaction. And so at that time he said, well, this is strict avoidance of those nuts isn't working out. I'm getting accidental exposure in restaurants and other places. And so we had to do something. And so we then said one way to approach it is the way we approach any allergy to any other substance. So for example, if somebody's allergic to cat or grass pollen, the way we approach it is we initially give a very small amount of that allergen and then gradually go up in the dose, and that way get the body desensitized to that allergen. So there are no real medicines involved in that. And so we said, well, we'll use the same approach in treating his nut allergies. And so he became the first person in the whole world who went through desensitization for 5 different nuts simultaneously. And 10 years later, he can eat all these nuts, and he can go to any restaurant and he doesn't have to worry about having an allergic reaction to those nuts anymore. And so since then, we've treated literally thousands of people with severe food allergies. But the other part of this food allergy problem is that many people have the anaphylactic allergy, but many more have milder symptoms. They may have chronic skin rashes, they may have chronic upset stomach, pain, diarrhea, nausea. All those symptoms can be present in many people who have milder forms of food allergies. And so over time, we've developed other ways of dealing with that. So there is another technique, we call it sublingual immunotherapy, where instead of actually giving those foods in to ingest, we actually have extracts of these food that we spray in the mouth, and that way desensitize the body to whatever the person is allergic to. And so that's the approach we've come up with to treat people with milder forms of allergies which are causing chronic symptoms. And then of course, we see a lot of people with different type of immune conditions causing chronic symptoms, such as chronic, muscle pain, joint pain, fatigue. And so those are different types of immune conditions that we also treat using immune modulatory type of treatment. So I don't have time to go into all of that, but that's the kind of thing that we are currently working on. And so,
so Dr. Sanjeev, that was a great exposition. So one of the things that most of the participants would like to know from you is, what are some of the preventive care techniques that they should adopt in this COVID time for food, against food allergies, right? This is also, there are certain seasonalities also in terms of, people, acquiring allergy or, that getting aggravated, right? So what are some of the preventive techniques you would advise to some of our participants? That is one question. And while you answer that question, I'm requesting the participants to put some of the questions in the chat box, because one of the things that Dr. Jain believes is that, if you have kids, they should be really, you should be addressing their allergy requirements much earlier, and you can solve the problem well ahead of time, and lots of sufferings is kind of eliminated, right? And there's another thing, have kids for younger children. That's a very interesting topic that I would like to request you to put in the chat box. So yeah, please go ahead on the preventive techniques, please. Yeah.
Yes. So so the question has 2 parts. One, what to do with kids, and meaning really young kids, infants, and what to do with older kids. From an immunologist perspective, anybody who is 4 years of age is basically an adult, because they have almost the same immune system as an adult. And so a person who already has allergies to certain foods, we have no choice but to avoid those foods. So we have to first identify what those foods are, and we have to avoid them until one can get the person desensitized. And so during this time, of course, the hospitals are all very much preoccupied with the COVID-19 patients, and it's also a very good way to acquire the infection if you don't already have it. So it's so people are you know, being much more cautious in what to get exposed to, so that you avoid having to go to the emergency room. The good thing about the time we're in right now is that people are not going to restaurants that often. They're eating at home mostly, and so that reduces the risk of exposure. When you know exactly what you're making at home, then the risk goes down. So that's one of the beneficial side effect of the environment we're in. Now, in terms of how to address food allergies in kids. So the kid's immune system in the first 6 months of life, and to some extent in the early age, their immune system is developing. And so very few people are born with allergies. Allergies is an acquired condition. And so the question becomes, how do people acquire allergies? And the answer to that, like with most other things, it's a very complex question. And so there is a genetic predisposition, which combined with certain exposures and the environment, especially the gut environment, the microorganisms that live in our gut and elsewhere that affect our immune system and are contributing to whether somebody develops allergy to certain foods or not. And so early in life, having exposure to all the allergenic foods has been found to be beneficial. It reduces the risk of developing allergies. So in the past, the recommendation was, if you're, if you have risk of developing allergies, avoid peanut, avoid, milk and all those other highly allergenic foods. And that recommendation has changed completely. Now the recommendation is even at 6 months of age, you're supposed to introduce all these highly allergenic foods in your diet. So that's a very important thing to keep in mind. And then the second thing is the role of fiber in diet. And that's very, very important in allowing healthy bacteria to grow in your body and reduce the risk of allergies, reduce the risk of inflammatory diseases. So I want to really emphasize the role of fiber in that whole process. Sorry, I think you're muted.
Yeah, so thank you, Dr. Jain. So as we are talking, there's one question which has come into the chat box, and it says that does dairy, mostly milk related indigestion, lend to its, one sec, lots of questions coming up. So actually the chat box is moving fast. Okay, so does the dairy, mostly milk related to digestion, lend to this immunodulatory treatment? For example, to introduce milk back in smaller portions, like 2 teaspoons a day for a week, and then 4 spoons a day, the next week, and so on. And this person who's asked the question, the person is saying that having known that the said indigestion is not a lactose intolerance issue, but a milk protein allergies issue. So that's the question.
Mm-hmm. Yes, so that's the basic idea of desensitization, that you start off with a small amount of whatever food you're allergic to, and then gradually go up in the dose, and then try to get the body desensitized to that. It's just that people who have really severe allergies, that approach really needs to be done under the supervision of a specialist who does that on a regular basis. Otherwise, the steps that are needed and the monitoring that's needed cannot be done very safely at home. So that's the only reason. But when I look at milk and the immune system, there are basically 3 types of reactions we have to consider. One is lactose intolerance, and that's not allergy, that's not an immune reaction, that's the body's inability to digest the milk sugar. And so that's a different problem, but that can lead to a lot of, GI symptoms such as bloating or diarrhea. And then you have milk protein allergy, which then can cause the more classic allergic type of reactions. But there's also a lot of interest in the possibility of milk actually increasing the risk of autoimmunity. And that is something that is being studied quite intensely, and there does seem to be some validity to this observation that milk could increase the risk of autoimmunity in some individuals who are genetically predisposed to that.
So thank you, Dr. Jain. So we'll try to keep the answers short because you have a very interesting challenge. The way the questions are coming into the chat box and the question answers, there'll be lots of them and very interesting questions. So the next one is, my son is 14 years old. From past 3 years or more years, while in sleep, he's making clearing throat sound, happens a couple of times in night for 5 to 8 seconds. This does not seem to wake him up, nor seem to have a sore throat. He had eczema and wheezing in his earlier years. He had some food allergies, wheat and milk. He had outgrown them since many years. So that's more like a observation, not a question. So your take on that. There's some another part that comes after that. I had taken him to ENT specialists, tonsils and and whereas adenoids has been ruled out, I have not taken him to sleep specialists to rule out sleep apnea yet. His doctor thinks it's a post-nasal drip. Let me know your thoughts. Of course, this platform is not for medical advice. Of course, we have always made that very clear to all the participants. But this is something which is definitely indicative of something which probably you can throw some lights. Yeah.
Yeah, so based on the history, it does sound like postnasal drip, but it will, of course, require a more detailed evaluation to be sure that that's what we're dealing with.
Okay, so the next question that we have is, I have a seasonal nasal allergy, and I get belching and gas with certain amount of gluten. Would you recommend that I take probiotics, or I do eat a lot of, eat a lot of fiber. So would you also recommend that I take some probiotics?
Yeah, probiotics, the way I look at it is the risk of taking probiotics is very low, and the potential benefit is there. So I do recommend using probiotics. The question that gets asked a lot is what type of probiotics, and unfortunately, we still don't have sufficient knowledge to be able to predict that. The way I look at the GI tract, it's almost like a rainforest in there with literally thousands and thousands of species living in symbiosis. And so by introducing a few additional species as probiotics, how will it impact the rest of them? And that's a very complex question that we're not able to predict currently. And so that's why it's worthwhile having a trial of probiotics. If it helps, great. If it doesn't, then at least you've tried it.
Here's a very short question. My husband is severely allergic to capsaicin. Any success you have had with this?
So that's something we need to investigate further. Capsaicin is a chemical, it's not a protein. And so protein desensitization is something that, we routinely do. Chemical desensitization is a lot more challenging, but it's definitely something we can look into and see if we can treat that condition.
The other question is, do you have an opinion of milk colostrum versus vis-a-vis immune health?
Yes. Milk colostrum is very rich and very healthy overall, and so I see no harm in using that. Yeah, I would definitely recommend its use, although it's not clearly proven that it has health benefits. But again, my from my understanding, I think there may very well be benefit in using colostrum.
So the other question is, our nephew has avocado allergy. Is there any remedy for that?
Yes, so we have successfully treated people with avocado allergy, and that's very treatable. And avocado allergy is a very common allergy, actually, one of the more common fruit allergies. And there is some cross reactivity to latex and other fruits also. And so we just have to look at the overall picture and treat it. But avocado allergy is very treatable.
Great. The other one deals with corn allergy with all corn derivatives. Your take on that, Dr. Jain?
Yeah, so corn allergy is certainly not as common as wheat allergy, for example, but we have seen cases of very severe corn allergy as well, and we have treated that successfully as well.
Okay, great. So there's another one which basically says, what do you think about A2 milk? And do you recommend this for those who have milk allergies?
I'm not sure what type of milk is that.
A2, the participant, would you like to sort of detail a little more in the chat box? It says, what do you think about A2 milk? A2 milk.
I'm actually not familiar with this type of milk.
Okay. The participant, the person asking the question is anonymous. Otherwise, I could have unmuted and the person could directly ask the question. Would you like to do that? Would you like to unmute yourself and ask this question? Otherwise, we'll go to the next one, which is, this one is, um, I think we will, what we'll do is we'll give you a little bit of rest, Dr. Jain, and we'll hear now from some of our other panelists to get a more of a user perspective, somebody who can connect with the participants in terms of their own experience, both as nutritionists. So in that context, we would request holistic nutritionist Veena Uttrawar to talk about meal plans, which is going to be enhancing immunity. So over to you. You are unmuted, so let me unmute you. Yeah, so yeah, you are unmuted. So yeah, go ahead.
Hi, Som.
Yeah.
Thank you, Dr. Sanjeev. Yeah, I think on A2 milk, A2, I have seen that in Costco too, nowadays coming. It has some stand, A1 and A2 is a ca casein, casein.
Mm-hmm.
It's the two strands and then they remove one. It's like almost like a old age, cow milk or something like. I read little bit about it, so that's
Mm-hmm.
all I know.
Interesting.
Yeah.
Yeah, you can go ahead with your meal plan. You've been doing a lot of work on that, so yeah.
First of all, I would like to tell ICC, CWC, we have this food project going on. And as a team, we recommend anti-inflammatory diet for the allergies and the viruses, many, many diseases that, could help benefit many people. And for that, I have presented last couple of times. And um, we are tying up with the Gelsa and the Amber and all that to provide some anti-inflammatory meals so that people can order to take home or going on, on the road. So if anybody has any specific um, suggestions, we're always welcome to mention about, what kind of a meals you guys want, so we can suggest them to prepare for you guys. That's on the food front. And generally, for anti-inflammatory diet, we are always recommending which as a gluten-free. In other words, I call it gluten-free, vegan, Indian, vegetarian meal, or a plant-based diet. With some exceptions, such as fish and eggs. For some people, they cannot live without that, and they have some different benefits or such like that. And then today, I would really like to say a lot of people who do follow anti-inflammatory diet to lose weight, they do intermittent fasting. With that, anti-inflammatory plus intermittent fasting. So that really helps to lose weight, which could help with many, like arthritis and all that, different diseases. There are a lot of benefits. And then we also have a True North is another place that they have a big on intermittent fasting. They help even cancer patients to. I visited that place, and then there were so many patients who were reversing their cancer. So that was really a big deal to see. Uh, One on one, I met those people, and that was a good thing. So intermittent fasting, there are a lot of benefits. It generally, basically, body takes time. It, we give a body to remove waste from the cells and allowing cells to rest and repair. So, and then also there is a big thing going on human growth, human growth hormone that also helps, which helps regulate sugar and fat metabolism. And then also, for vital stress, immunity, and all that, the oxidative stress and inflammation I was talking about, that also and then your metabolic rate increases. And then for diabetes, I know type 1 diabetes, I think, it is not recommended. But type 2 diabetes or insulin resistance, all that, it really helps for those things too. And it decreases triglycerides. Uh, there are lot more benefits.
So, Veena, I just want to tell you there's another question which has come up, and you might like to adjust your connection a little bit. It's maybe outside, it's not really catching the Wi-Fi very well. So, it's still kind of wobbly, your connection. So you might have to take care of that. And the question that we have now is that this is going to be for anyone who can answer this. What type of diet one should eat for arthritis patient?
Probably an anti-inflammatory diet. I think if you're eating a whole food plant-based diet, that's probably, and maybe add some spices like, which are basically help with the anti-inflammatory, cumin, some of the other spices would help on that.
Dr. Sanjeev Jain, you want to add something to it?
Yes, I think this general recommendation that was given to use more anti-inflammatory diet. The other recommendation that's often given is to add antioxidants in the in the diet. And so there are, vitamins such as vitamin C is a very good antioxidant. But then there are others, for example, for many people with rheumatoid arthritis, we would recommend things like N-acetylcysteine, which is another antioxidant that is available in different health foods. And so those would be the general recommendation. Now, the other thing we find is that a lot of people have allergies as a contributing factor, and actually there are books written on this also about different diets, and this is a common thing we hear, that certain foods exacerbate their arthritis, and so whatever food is exacerbating their arthritis, it's worthwhile avoiding that food, of course, and in some cases we do perform allergy testing too, because there are publications which show that this one type of cell, the so-called mast cell, is actually very important in joint inflammation also. And so there is that common pathway between allergy and arthritis through these mast cells. And so that's one other thing we do. Of course, arthritis is not an allergic disease by any means. It is an autoimmune disease, and so that's how we need to treat it, like an autoimmune disease. But food definitely plays a role in many people who
So there is an addendum to that question on arthritis: is what type of spices?
Yeah, so again, that's something others may be able to contribute more. I mean, among Indian spices, we talk a lot about turmeric having, anti-inflammatory properties as well, cinnamon having those properties too. But again, I'm not an expert on that, so somebody else may be able to answer that better.
So there's another question, which is intermittent fasting suitable for kids, teens, etc.? I mean, of that age group, kids and teens. Does it help them to grow taller or, at a quicker rate? Or, since somebody, I'm not very sure how this came up, that intermittent fasting increases human growth hormone. So this is a question. So any clarification you want to provide on that?
I can. There are a lot of studies. This has been experimented on more generally disease-based people, or like the diabetes or blood pressure, cancer, like major diseases. And yeah, the kids do it on themselves, but there are not many studies done to tell, like.
Yes, I personally would be cautious in recommending it in kids. The data on the basic science level is very strong in adults, but not so strong in kids. And so it's I don't think we can recommend that for kids who are in their growth phase, in terms of we don't know what impact that will have in those kids.
There's some good references on intermittent fasting. Dr. Jason Fung has a book out called The Complete Guide. And I think Dr. Walter Longo of the University of Southern California has some interesting research on that. And this is fasting is part of many cultures. And basically, obviously, if we're talking about a toddler or we're talking about a small child or a baby, you definitely want to make sure that the baby is getting the correct amount of nutrition so it is able to thrive. So, but for, once they get past that particular point, it depends on an individual basis. Once again, talking with your physician and doctor, before you start any type of program like that is always a good advice. So, but I think there's lots of material. There's some videos on YouTube, by the way, on intermittent fasting, and some good resources there too.
So there's another question. This is very generic. If you have immune disease, is it okay to go on a vegan diet? So this is something, Doug, you have been doing a lot of research as a food for health champion and as an activist, and you've been following a lot of, published paper and research on what's going on there. Would you like to take that? Let's hear, and then we'll request Dr. Sanjeev Jain also to, give his insight on that. So over to you, Doug.
So what's the precondition again?
There's no precondition as such. Basically, it's a very generic question. It says that if you have immune disease, very generic, it doesn't say, is it okay to go on a vegan diet?
I think if you're on a vegan diet, or if you're on a whole food plant-based diet, which is a little broader than vegan, I think it's going to strengthen your immune system. And I think the problems that we're having, especially, I'm right now trying to track the impact of the diet on this COVID-19 situation that we have worldwide. And I'm seeing some individual reports. These are not studies, but they're individual case studies of people who have been on a whole food plant-based diet. Then it actually caught the virus and then had a very mild symptoms. And this was a person who was 80 something years old and that type of thing. So I'm in a situation now where I have some premorbidity types of issues which have been identified as that you're more at risk. And that is I'm over 70. Number two is I've had coronary vascular disease previously in my life, and I was a diabetic and I had high blood pressure. My God, you won the lottery with that. But what I'm finding out is there is a lot of, right now, a growing amount of evidence that, food can be prophylactic in terms of helping you strengthen your immune system so that you can deal with the, with inflammatory conditions. Not to say that that's a cure. Not to say you should go out and test that theory. So, aside from everything else you're doing, I don't think there's any problem in doing a whole food plant-based diet and staying away from even dairy products, which basically can be inflammatory as well, and as well as being cancerous, as well as some other things which are out there. There's plenty of substitutes which are available. And so it's important that people take a look at, what their options are and basically take the all of the above strategy. We want things that are going to keep us healthier and actually help us increase our immunity. Doctor, I'll pass that on to you in case you had more to add or a conflict with that.
No, I completely agree with you. I think many studies have shown that plant-based diet or reducing the pro-inflammatory type of food is beneficial. Of course, once somebody has advanced disease, then it may not help as much as just as a preventative measure. And so that's where I would most strongly recommend it. Yeah.
Well, I think we're totally talking about, sort of like preparing yourself so that you have the strength, you have as strong of your immune system and as healthy of a body as you can have to deal with the challenges of this disease. Because you're going to have people who are going to catch it by no fault of their own. They just run into somebody. And the theory is that pretty much everybody sometime down the road will catch this thing. And the social distancing and the staying separated from other people is basically a delay line. It does not fix the problem. If we want to ask where did the problem come from in the first place, that is pretty clear. Dr. Greger of the nutritionfacts.org did a very interesting video where he talks about where do these viruses come from and how do humans get them. And the common denominator is they all come from basically factory farms and people who use meat as food and people who use products from animals as food, which we were not necessarily designed to eat, because the conditions that are in these environments, especially in the factory farms area, if they're petri dishes, which help grow the viruses and help get people sick. So animals get sick, some of who die while they're in the captivity. Then they're ground up and fed to the cattle, by the way, and then we eat the cattle and stuff like that. So it's it's sort of a vicious circle. The problem we have as a culture and as a world is we have conditioned ourselves, and we are optimally conditioned to eat a pattern diet which is similar to what we've always eaten. So changing our behavior is very difficult, and I really think it's very hard for people to give up cheese or to give up, foods which in the end of the day may not be healthy for them. That's why we have the obesity problem and also the heart, the coronary problem in this country.
So
So
there are two related questions on intermittent fasting. So one basically says that for intermittent fasting, what kind of fasting window would be suggested? Is it a 16-hour fasting window, or what is the ideal window? That's one part of the question. And there's another related question which has been put together on this, is that what precautions need to be taken for a person with, affected with acidity problems for intermittent fasting. So what precautions required for them? Yeah. So one is a fasting window, otherwise for people who have trouble with acidity.
Yeah, I can take. So for fasting window, yeah, 16:18 is good. 16:8, sorry. And then there are other methods also. I think eat, stop, eat, which involves 24 hours fasting twice a week. And then there is another one is 5-2 diet. That also is like 500, 600 calories that you can consume for, 2 consecutive days. There are, it's like upvas in India, many, from many days, our parents and all that, after 40, 50 years old, they started fasting different ways. So generally, studies that they have proven here are mostly based on 16 hours of fasting.
Great. Anything you want to add?
And then for the acidity, in the fasting acidity, it all depends. There there are 2-3 things that you have to pay attention to: what foods you eat and what time of the day you eat, and like when that acidity you feel. It could be from the foods also that you are eating more acidic foods. Like, I don't want to get into Ayurveda, but more acidic foods, or like even if you eat like broccoli is good, and then you eat a lot of broccoli or kale or like cruciferous vegetables, then you fill up with a lot of acidity. Or black pepper, like spices of cinnamon and black pepper, cloves, like those are spicy, the acidity increasing herbs. So probably you have to balance, and then you have to put a food diary to uh, see, and then balance it out a little bit.
I've been doing intermittent fasting now for about 2 years, and there's many styles. Once again, Jason Funk's book called The Complete Guide to Intermittent Fasting goes through each of these. Once again, if you decide you're going to do that, then obviously consult with your physician. Uh, the what I'm doing is essentially one meal a day, and that is around 11 o'clock in the day. I will have like a 2-hour eating window, and then I don't eat again until the next day around 11 o'clock and that type of thing. That seems to be good. It controls my any type of weight gain. You don't really have to, if you're eating a whole food plant-based diet and doing that, you really don't have to measure a lot, because the calorie density in whole foods is a lot smaller than it is with other processed foods. So the challenge is finding the right diet that works best for you. And if you basically have reactions to particular foods, as we just heard, you may not want to eat peppers, and you may not want to be. I eat pretty much anything that's, well, those, the curse that I have. I used to be on the seafood diet. You see food and then you eat it. That was basically it. But now, of course, I basically have my rules, and my pattern of behavior has now been worked in that I have basically a large salad which has nuts, and it's what Joel Furman calls a G-bomb salad: greens, beans, mushrooms, onions, and seeds. And then in the salad, and then with the avocado in it, and then I make it up, and then I break it out into meal size bowls, and then I basically have that, and then I have a bowl of soup, and that's it. Maybe an apple, and that type of thing. So there's lots of ways of doing this. There's a lot of resources which are out there which will give you some guidance with that. But also, if you have a doctor that's tuned into basically, nutrition, which is not necessarily a lot of doctors, by the way, then
So, Doug, thanks for that. Thanks for that. I think there are a lot of research out there, and I just want to let you know that Doug runs very, very extensive newsletter which captures the best probably all over the world. So anybody who's interested in this can subscribe to his newsletter. It is just a wealth of information, and he has dedicated his life to this. This is remarkable what he has been doing, and now even more. So anybody interested can definitely get into his newsletter, and that's a lot of wealth of information. Now there's a very interesting question coming, and this is more directed to Dr. Sanjeev Jain. Do you have an opinion on the immune system overreaction? Okay, the immune system overreaction on the cytokine storm associated with COVID-19, and the ways to alleviate it. That's an interesting question. Yeah, we are hearing a lot of that, and it'd be good to get your insight. Yeah.
Mm-hmm. Yes, so this is one of the biggest challenges with COVID-19. So people who are having a negative outcome from this infection, they're having it primarily because their immune system is getting overactive, and then they're having this cytokine storm. And so anybody who has an existing autoimmune disease or pro-inflammatory disease is at higher risk of that condition. And the other thing we recognize now is that blood clotting is also a very important component of this process, and that's one of the reasons why people with coronary disease or other types of vascular disease are at higher risk of complications from it. So our approach in reducing that risk is to treat the underlying disease as best as we can. And so once the underlying disease is treated, the inflammatory state is reduced, then the risk of complications if they get an infection will hopefully be improved. And so, for example, if somebody has asthma, this is a question we get very often, that if somebody has asthma, should they still be taking their medications? And some of those medications are designed to actually lower the immune system. And so then the question becomes, can they actually promote the growth of the virus? And the answer is typically, even with those asthma medications, the body is still able to fight off the infection successfully. But what it does is it also reduces the inflammatory state so that the risk of complications from the infection go down. And so that's why it's very important to treat the underlying disease as well as you can to reduce the risk of complications from the virus.
So there are more questions coming in. So just for proper time management, I'll combine two questions. They're related, so I just combine them. One is, what are some of the vegan and other alternatives for milk? That was the question. And also the recommended best oil for cooking. So these are the questions, yeah.
So there's a lot of plant milks. There's soy milk, almond milk, rice milk. There's coconut. Or there's uh, I think either soy or almond. Is plentiful, available at Costco.
Oat milk is now
Rice,
very, very
rice milk,
prevalent now.
oat
Oat
milk,
milk, yeah.
Exactly.
oat milk, rice milk, cashew milk. There is a
Yeah,
cashew milk.
cashew, yeah.
Yes.
You
Which
get cashew milk yogurt as well, yeah.
yes.
Yeah,
Yeah.
you give coconut yogurt also.
So, and what about oil? I mean, there are lots of recommendation and, and arguments and counter arguments. So how does one pick the right oil for cooking?
For Indian cooking, I recommend avocado oil or coconut oil, grapeseed oil, because we heat little, we cook in a little higher temperature. These are the best I can think of. And then GMO and all that, considering, like a good oils, or these are the ones. Some people really, sunflower oil and all that also suggest, but those are all getting into GMO also. So we have to be watchful where it is coming from and all that. So easiest thing is avocado, and the grapeseed oil is for the cooking, and coconut oil.
Okay, we have few questions also with us. And I have a request from Mr. Naren Bakshi from Jaipur. Naren, you can unmute yourself. You wanted to make a comment. Yeah, you can do that. Let me allow you. I'll just unmute you. Yeah, go ahead, please.
And can you hear me?
Yes, very well, very clear. Yeah.
Well, I just wanted to let you and the participant know that although I'm sitting in Jaipur, wonderful morning. There are many people in Jaipur that also are listening. And so I want to congratulate the people, all I know, Sanjeev and Neepa and you and Doug. And so very delighted to see these focused things happening. Because whenever, Sanjeev, we did a big conference, naturally, you could focus on children or something, others may get bored, but here we can do very focused things about the topics we have at hand. And what I learned here was that most of it was based on the questions. So I'm delighted. So congratulations and keep on doing what you're doing.
Yeah, thanks. And I just wanted to say, yeah, sorry, go ahead, Sanjeev. Yeah.
No, I just wanted to thank Bakshiji for participating and starting this movement. So it's pretty remarkable what he has accomplished here.
Yeah. And I want to tell all the participants that, same time next week, we are going to have a part 2 of this program, right? Because the number of questions, we'll try our best to accommodate all the questions. But we'll add, more topics, other topics which we have not, because the immune system is very, very important. And today, one of the things, even you will agree, that we are talking about, you can only be a superpower if you have the immune power, right? Earlier, there was a, arms race. All the countries were fighting on an arms race, like the superpowers. Yeah. Now, it's an immunity race. So it depends which country is actually going to win the immunity race, and that's what's going on, right? Whether it's through herd immunity or healthcare system or a better healthy population, what seems to be the future is that nations are competing to actually become an immunity superpower. I mean, that's where the strength lies. So yeah, having said that, so we'll continue with discussion, and we like to have a 2.0 of this next Sunday. So be with us. And the same registration link works. So please send us your mail to CWC event. I will put it in the chat box. Any other comments, and we can also take it up next time. But still, let's go. We have a bit of time. So let's go with some other questions. People who are prone to wheezing, cold, cough, respiratory problems, are they high risk category for COVID?
Yes, so this is something I just mentioned earlier, that all those are ultimately inflammatory conditions. And if you already have an inflammatory condition, you're at higher risk of complications from COVID-19. However, if those conditions are under good control, then the risk goes down as well. And so the same point I made earlier, I would make again, that you want to reduce inflammation by whatever means that are available, either through medication or through change in diet or whatever means, but we need to reduce that inflammation to reduce the risk.
So, Son, I would like to request something for the next topic. Since I'm in Jaipur for some time, we all know that there are certain foods that became part of Indian way of life. Whether it was turmeric, whether it was dhania, jeera, whatever. So there may be usefulness to say what was the Indian way of life before, and should we be adopting more of that, even though we are living in West? So that may be something that if Nipa, you and others could think about and focus on. Mostly they came from Ayurveda side, but it was home remedies. Something simple. You add this in your food, and you will get better. So they were all immune based. So just a request.
Yeah, so one very quick question, I think can be answered fast. That is, are inflammatory conditions same as immune conditions? I mean, that's the question.
Yeah, so inflammation is the response of the immune system to a danger signal. So whenever, for example, you are invaded by a bacteria or virus, then the body develops an inflammatory response to it, and that is inflammation. Immune system is, of course, a broader term which encompasses not only the beneficial response to an infection, but also the potentially damaging response. So that's, for example, for COVID-19, we were talking about that if somebody can't fight off that infection, that's a bad thing, but it's ultimately the immune system that's fighting off that infection. And so that's the positive side of the immune system. But the negative side is if it overreacts and has a very intense inflammatory response, then that can be detrimental to the body. So inflammation is part of the immune reaction to a danger signal, but some people may have immune deficiency type of diseases too, where they can't mount a good response to an infection, and so that also is not good. But those conditions are less frequent than the pro-inflammatory conditions such as autoimmune disease or allergic disease. All the things we've been talking about, those are all inflammatory conditions, and they're the ones that cause a lot of damage to our overall health.
Thank you so much. I think we'll wrap up. Any concluding remarks from all the panelists here? Just one-liners. Anything that you would like to suggest to the participants? One-liners. So,
well, again, want to thank everybody for participating, and it was a very good session today.
thank you.
Thank you, everybody. Stay safe.
Stay safe, stay healthy, keep drinking lemon ginger water.
Thank you. Thank you, everybody.
Thank you.
Bye.
Okay, bye.